So how are you feeling today?
There's definitely a mixed emotion, a lot of emotions going through at the moment, and definite sadness that we've got to this point, and to be honest, shock that we've also reached this point and it's been allowed by the government to get to this point. A number of times we've asked for the imposition to be lifted and we avert these strikes and go straight back to work, and I think that offer still stands. If Jeremy Hunt gets to watch this and he sees that he sees me talking, that's the only thing that that will avert these strikes, and that's what we need to happen, because we can't negotiate with the gun held to our head. I think there's also a sense of almost pride that the people inside Bournemouth Hospital are standing with us and backing us up. My job is being taken over by a consultant, as are every junior doctor in this hospital, being backed up by either nurse practitioners, allied health professionals, or by consultants stepping down into the roles of the juniors. This means elective care and non-urgent care has been cancelled, and that's regrettable. We don't want to inconvenience people. Thankfully our hospital never booked anyone in these appointments, and they haven't had to cancel too many people, but it's the fact that they could have had these appointments had this strike not been taking place and had the government not let this strike take place. So I feel that as doctors we're being insulted, and that's part of how I feel today, especially when Jeremy Hunt stands up in Parliament and says that we're being misled by the BMA and that we don't have an ounce of kind of self-decision making, and how we weigh up decisions on a daily basis, how he has the gumption to say that we don't know how to see a contract for what it is, and that is an unsafe and unfair contract for both for patients and for doctors and for the NHS. It's an unworkable situation with regards to rotas, with regards how it treats women, and how it seems to think that it can fund a 7-day NHS when currently the funding for a 5-day NHS isn't enough. We are struggling in every hospital across the country, some more than others, and the money just isn't there, the funding just isn't there to create a safe working environment. And that's our worry, is that if we are spread even thinner, and if rotas aren't being looked at carefully, and there's not enough doctors as it is, if doctors are being asked to do more without any safeguards for working over the hours, we're just going to end up demoralised, tired, and not able to make these decisions and weigh up these decisions, because we won't have the clarity of mind to weigh them up after working however many hours straight or in a week. And I think that's why I feel almost insulted today, that we've got to this point and that the government haven't backtracked and turned around and said, you know what, you doctors actually know what you're talking about. You can weigh up and analyse information as you do with every drug you give and every diagnosis you make. You weigh up the information and make a judgment call, and we've made our judgment call saying this contract is unfair and unsafe to patients and to doctors and to the NHS.